Hello, my name is Jessica Fernando, and welcome to my first vlog for this semester. And for this vlog, I am going to mainly answer and reflect on the discussion prompt of think about a definition for professionalism in your current environment and describe how you know this. So for my fieldwork, my setting right now, I am in a long-term acute care hospital. And for this specific setting, my definition for professionalism would be showing genuine care to patients who are experiencing difficult conditions. Professionalism is also defined by maintaining strong relationships with colleagues in order to deliver safe and high quality care, as well as being reliable in carrying out responsibilities for patient care. And how do you know this? So in terms of showing genuine care to patients, I know this as I've observed my CI actively listen to her patients as they talk about the difficulties of their diagnoses and what they have to go through on a day-to-day basis. She takes the time to listen to what they have to say, and then she also uses empathy to understand why they're feeling that way and how she can empower them to engage in therapy and regain their independence. And in terms of building strong relationships with colleagues, I've sat in on a few of my CI's team meetings where she will talk with doctors and nurses, dietitian, respiratory therapists about the patients, and she is truthful about the patient's progress, and she will reflect on their progress in therapy, and she takes the time to really engage with the other healthcare providers and build rapport with them so that she can contribute to delivering high quality care to her patients. And then in terms of being reliable and carrying out responsibilities, one thing I've noticed in particular with my CI is that a lot of our patients in the LTAC, they are of course bed bound, and they have a lot of different conditions, and a lot of them are on trachs, so that means that they can't speak, or they're also unresponsive. So my CI, she takes the time to really work with them even if they can't speak or move. At the most, we will do a passive range of motion with these patients so that they are still engaging in movement even though they don't realize it. We're still preventing decline, and then we're helping them to stay active. So that's how I've noticed that she's reliable in carrying out her responsibilities for patient care. And then in the article that we read this week for enhancing, that was titled Enhancing Professionalism Among OT Students by Rader et al. This article particularly talked about how faculty have a more profound understanding of professionalism compared to students who mainly view it as a trial and error. My CI and I can relate to this in particular because I normally viewed professionalism as being on time to work and dressing professionally. According to the dress code, I thought of it as more at a surface level, whereas my CI explained it to me on a deeper level that professionalism goes beyond all of those things. It also encompasses like lifelong learning, emotional regulation, and cultural sensitivity. So I'm starting to learn more about professional behaviors with my CI. Thank you for watching my vlog.